Okay. So thank you for the attendance and for you staying late in the second day of the conference. And it's an annual ritual that we try to share what has been done over the last year as a point of just trying to acknowledge the people who had activities over the year. Then after that, we have our annual Prof. Ibrahim al-Muflih Award in recognition of service of gastroenterology to one of our members. So we all like metrics, and Turk Al-Amil likes his discs and his scores, and I think it's embedded us into looking at numbers. And I'm not sure really how we're doing, but I'm going to just showcase what we've done over the last year and hopefully what we're going to do next year. And the judgment of success, although there are quantitative measures, but I'm sure there's qualitative ones, and there are emotional ones and social ones that we might not be able to capture solely, and I'll leave that judgment up to you. I'll also have to acknowledge that our members are very active in their healthcare provision to the population they serve. They're busy clinicians, they're academics, they're researchers, they're administrators, and all of those roles take some time, and at the same time they still give this to this society and community in service, and it's really, whatever we thank them for, it's not enough. Again, we try to shift from, you'll see the theme over the year that a lot of the conferences are really problem-based, case-based discussions, clinical rounds. Dr. Fahad Sahibani has introduced that rather than the classical didactic type of lectures that we've done over the years. So I'll just go over them quickly. So the GI board review course has been steady for, I have no idea, maybe like the 13th or so. And even it expanded to the Eastern Province now, and it's been a steady program. I think it has its impact with our fellows. A new flagship that has been added over the years to the portfolio of the Saudi Gastroenterology Association is the IBD Masterclass. It's grown in size and coverage. Now I could dare and say it's even a regional meeting for inflammatory bowel disease in the region. If there's a meeting, it's this meeting you want to attend. And then it's shown by the diversity of the speakers, attendees, the discussions, and the caliber. This last year we had about 370 attendees for a specialized subspecialty conference. I think that's a good number for the region. It was associated also with a nurse's course, also associated with a session on female practice in gastroenterology, and there was a pre-conference course on intestinal ultrasound. All of these activities packed into 2 days was a real great accomplishment, and I'll have to thank the team that organized this. Another type of engagement that we do with our community is the patient engagement in World Days, and one of that is celiac disease that's been active, but maybe inflammatory bowel disease has also been an active area. And I like this picture, and although the activity has been over 3 cities, but the attendees, you can see the passion. This is like after hours. It takes a lot of their time, organization, and you engage with the community, and it really has an impact. There's increased awareness and knowledge, and it really warms your heart to see how people are happy and engage in these activities in malls and public areas. Again, when we talked about problem-based learning, this has been going on also for a few years. The Saudi IBD panel and the fellow IBD course, all of these are engaging healthcare practitioners, general gastroenterologists, internists, and IBD fellows on how to manage inflammatory bowel disease. And it's as you've seen with our lectures, there's a lot of emphasis. It's a disease burden with a lot of morbidity and cost to the society. The neurogastroenterology group has grown in strength and number, and the conference is growing year by year. This year we had our 6th meeting, and the attendance and the outcomes were very phenomenal. I'm not even going to talk about the number of gut clubs. We cover about 6 cities in the kingdom with almost a monthly or bi-monthly meeting in each city. We have our regional meetings that have been done in two different cities. We have our webinars with the ACG. We have also other online forums, the Crohn's and Colitis Gut Club. All of these activities are going all throughout the year, and it's been very interactive and building up the communities within the cities themselves and in the practice. We're not closed on ourselves. We've opened up to other areas, people who don't attend international meetings. We usually, our delegates, our members go there. We have our briefing on it on DDW and UEGW. We also endorse activities that we think are unique and add a flavor to the country. Dr. Bandar al-Judaybi had his meeting this year on gastroenterology, transplant, and oncology, which is a unique twist to how to look at patients and the specific challenges that they face. And we were happy to be as a participant in endorsing that activity this year. This was a public campaign that we did with the industry. It was well structured. It had an outreach that was very impactful, and there was a structured program, and the number of attendees who chimed into this activity and touch points were very impressive, and we again think that it had an effect. The nurses are an important cornerstone in our practice. This is the third endoscopy nurse skill program that was done on its own, dedicated to nurses only. We had 180 attendees last year. This is a physical activity, not an online activity, so having 180 attendees is not a small feat. You had a complete session on our flagship, the Saudi Journal of Gastroenterology, and I can't thank the editor-in-chief for bearing with us all these years, and the associate editors for working on this project. It's not an easy task, and we really thank them from our deepest appreciation from their activities. Last year I had this presentation and I put this slide up, and we said we are going to, we promised a clinical care pathway for gastrointestinal reflux disease. We delivered on this promise. We have a guideline or a pathway consensus on the management of gastroesophageal reflux disease that was published this year. Also last year we had a publication on inflammatory bowel disease in adults. We promised a second and third part, and the team came through. This was a collaboration with the Ministry of Health, the Saudi Society of Clinical Pharmacology, and we had the guidelines that were published on managing inflammatory bowel disease in pregnancy and children and adolescents. So we delivered on those two. Coming to this meeting, and I think it's growing year over year, and it's something that's warming to us. The postgraduate course is still ongoing, or it's just finished next door. That's another activity. The endoscopy nurse skills program was this morning, yesterday morning. Endoscopy course was well received by our attendees. It was mostly focused on fellows, but we had also practicing gastroenterologists that chimed in. We had their hands-on workshop that continued up to 9 p.m. And I thank all the organizers and the faculty that joined us in this activity. This is another initiative that started, and hopefully we're going to take on a project that's going to go over the upcoming 2-3 years. We're going to dedicate 5 centers to join this initiative in trying to standardize the quality metrics in the country and having something similar to the JAG in the UK. So again, this is another line that we're going to work on over the upcoming 2 to 3 years. The nutritional symposium group, the nutritional group has grown strong year over year. I think they're very independent, they're very well capable, they have their vision, mission, they have their targets very well documented, and they're working very well and hard in that field. High resolution manometry, again, it's the basics, targeted to fellows and gastroenterologists, how to set it up, how to interpret it, and then it's been also well received within the practitioners in the meeting. This is another twist that our members put in. Meet the expert, mostly targeted on people career path. It was impressive. I participated in it. It was a very interesting discussion. It's like an open mic forum. Women in gastroenterology, again, this is the poster that was circulated in our WhatsApp group. And there was a comment that it should not be challenges. That was striked, and they called it success. And I agree with that twist. So that was the theme. And the group is doing very well, mashallah, tabarakallah. Each and every meeting we have a women's section. We had guests this year, which was very interesting. We had the delegation of 30 gastroenterologists from Pakistan. First time, we're happy to have them, we're honored to have them, and I hope they really enjoyed their time and experience in the country. So hopefully again and again, year after year. IBD-ME, this is something we launched last year. We spoke about this was a multi-country consortium that tries to mimic other registries like the GetAid registry, UAE, Kuwait, KSA, Jordan, Lebanon, and it's governed by the societies, and where countries doesn't have a society, there is a delegate. It aims on research, education, patient care, and publications. We delivered, although we wanted to do more, but at least in a year, we already have an educational program out online that's asynchronous. What's ready now is for non-IBD specialists, general practitioners. Then we're going to have one for IBD specialists. We already have two publications out from the group. One describing the setting up of the system, the challenges, legal, logistical, governance, and it took a while to set it up, but it was succeeded, and we published that experience. Also, Dr. Nahal Azzam organized the first publication from the registry itself, multi-country, on real-world data on the efficacy of vedolizumab in inflammatory bowel disease. So hopefully this is going to be a cascade for a number of other publications. Again, Nahal is spearheading the upcoming publication on pregnancy outcomes in patients with IBD on multiple countries. Also last year we promised a facelift for the IBD guide. And Dr. Iman Sles and her colleagues and a lot of colleagues in this room worked on this project. It's a website in Arabic for patients who can log in, have reliable information, and it addresses a lot of questions. It has topics looking at diagnosis, outcomes, nutrition, research and updates, as well as patient testimonials. So we included patients in this website to write their own experiences with the disease. It's going to be updated. There are a lot of hot topics. It taps into issues like lactation, fertility, mood disorders, triggers. It's the topics that you really want to hear about in the clinic, and you might not have much time to discuss it with the patient. What I usually do is refer patients to the website, and the second visit I ask a lot of, they can ask their questions and we address them. It's written by fellows and checked by consultants, so it's double vetted. Then there's an Arabic تنقيح باللغة العربية to the content, and there's then the visual aspects of it, and other resources for patients to go into. This is a project that happened a few years ago. It was a ما أدري وش أسميها مشروع تخرج للfellows. Yeah, it was something like a graduate type of community thing that started as an idea. We said, okay, part of the training program, fellows have to do some sort of research community service. Let them do this. And it grew on its own, and now it's a project that's giving year over year. Other areas that happened over the last year, we started our outreach program to international organizations. The GI Motility Group reached out to the European Society of Neurogastroenterology and Motility. Multiple countries are members of it, and this year we became part of that consortium. Also, about 2 to 3 weeks ago, there was a meeting on the governing board of the SGA for an application, and we got through the application, so we're going to be a member society in the SGA hopefully soon, and that we're going to meet with the board in their upcoming meeting. At the same time, we're in discussions with the British Society of Gastroenterology to try to forge some sort of collaboration between us and them. The Saudi Health Commission also, not Saudi Health, the Saudi Commission for Health Specialists also had their new regulations to be an organization that accredited CMEs. We had to go through a lot of loopholes and checks, and we got that at the beginning of this year. And although this is not an accomplishment for the SGA, but we think it's worth mentioning and being proud. She was always one of us, but it's nice to have it. Dr. Nahla Azzam became a Saudi citizen this year, and we're really proud and happy for that. So I just wanted to share this. It's not an accomplishment, but we're happy. I have to thank Dr. Mohammed Khan, Najla, Nawaf. All of these activities would never have happened without them and all the people who worked hard to it. Just to share with you with the upcoming calendar, just a few events if you want to reserve them. There's an IBD preceptorship program in January. Our 7th GI motility is going to be in February. April, we're going to go into the domain of endoscopy. We're going to have our endoscopy conference. We stopped for a while, and I think there's a space for us to improve. So that's going to happen hopefully this April. Our 3rd IBD program for fellows is going to be in May. September, we're going to have our flagship masterclass. And SDDF, reserve your calendar for December next year. Thank you very much.